Good morning. Myself, Dr. Nandini. So today my topic is going to be about irrigants. So, why do we use irrigants in endodontics? So, basically, the root canal treatment that we do, it involves three main steps. That is access opening, cleaning and shaping, and obturation. So, after opening and access, we gain. After we gain access into the root canal, the second step that we proceed with is cleaning and shaping. That is, we remove all the infected necrotic debris or any vital tissues that is present by with the help of various file systems. And apart from using this mechanical debridement methods, we also require some chemicals in order to aid in the removal of complete removal of necrotic tissues. So in that aspect, we use various chemicals, that is as irrigants and as intracanal medicaments. So this irrigants we use it along with the mechanical debridement. That is when we do the instrumentation with the files. In between, we use all these chemicals, which will help in the flushing action of all the debris out of the canal. So we have certain requirements or prerequisites for an irrigant to be used in a root canal treatment. That is, they should have a sufficient washing action, and they should be able to reduce the instrument friction. That is, they actually give some kind of a lubrication effect when we use it inside the canal. They should also help in removal of the calcified dentin and dissolve any inorganic tissues present, and it should also be able to penetrate deeper into the canal peripheries, especially at the apical portion, to completely debride the necrotic tissues present and help in the complete disinfection of the canal. So we have different school of thought, like depending upon the classification of the irrigants. So broadly, it is classified as a chemical agents and natural agents. And apart from those mentioned in this table, we have other irrigants that are like saline. Saline was the most commonly used irrigant in clinical practice. Apart from that, the hydrogen peroxide was used. It was one of the oldest irrigant that was used. And tetracline, Q-mix, Redels are some of the newer irrigant solution. And under chemical agents, we have tissue dissolving, that is sodium hypochlorite and hypochlorine dioxide. And then we have antibacterial agents, that is chlorhexidine and MTAD. MTAD is nothing but mixture of two to three components, which will be discussed later in this PPT. And apart from this, we have some chelating agents, which has got efficient action in smear layer removal. That is, we have examples like EDT and HEPP. So in this PPT, we will be concentrating only upon a few irrigants, which is required for an undergraduate level. So amongst this, the first most commonly preferred irrigant is sodium hypochlorite. So sodium hypochlorite was basically used in World War One by Dakins as 0.5 percentage concentration for wound debridement. Later, Coolidge gave it in endodontics. That is, he started using hypochlorite in endodontics. So in endodontia, the concentration that is preferred is basically from 0.5% to 5.25%, and in this 5.25% is the most effectively used concentration. But in order to avoid any complications, we prefer 2.5%, which is considered to be the safest concentration to be used in the clinical practice. So mechanism, when it comes to mechanism, there are different mechanism, out of which saponification reaction, amino acid neutralization, chloramination is the most commonly happens. Saponification is nothing but the formation of soap and glycerol will happen. So basically, this will reduce the surface tension in the root canal, which will aid in further penetration of the hypochlorite into the tubules and then the dentin, and help in the complete disinfection. And amino acid neutralization reaction is nothing but the hypochlorous acids which is formed. It will go and neutralize all the amino acids present in the bacterial cell wall and cause the bacterial cell wall lysis. And similarly, the chloramination reaction is also the formation of various chloramines that will happen. All these chloramines will go penetrate the bacterial cell wall, cause the lysis of the bacterial cell, and cause cell disruption. So properties, it has got an excellent tissue dissolving property. Within like 20 minutes, it can dissolve the tissues. Whereas it comes to smear layer removal, compared to EDT, it has got lesser effect on smear layer removal, and it has got a good antibacterial action and concentration, as I've already told, 2.5% is the most safest preferred concentration. Coming to drawbacks, it has got a very unpleasant taste and smell, and it can also cause a lot of damage to your fabric when it is not used in a proper way. And sometimes when it is used in excessive concentration, it can cause ulcers, as I have shown in this diagram. And sodium hypochlorite accident usually happens if you do irrigate the canal more actively. You should always irrigate the canals with hypochlorite passively. You have to make sure the irrigating needle which you use will not bind to the canal, and you have to make sure you stick on to the working length strictly, in order to avoid extrusion of the canal outside the apex. When it extrudes beyond the apex, then this hypochlorite accident happens, and it is a very emergency condition. You have to make sure immediately you have to stop using hypochlorite. You have to flush the canal with the saline, and you have to make sure the patient is stable, the airway and all. You have to make sure it is stable, and if it is still what to say, if there is any disruption or airway obstruction is there, immediately you have to take to a general care. So, in order to avoid this sodium hypochlorite accident, what we can do, instead of using an increased concentration of hypochlorite, maybe we can reduce the concentration of hypochlorite and use it multiple times. Like, for example, you can heat the solution and use. Then, in that case, the efficiency of the hypochlorite is increased, and similarly, the time of contact can be kept more, and volume can be used. Instead of increasing the concentration, you can decrease the concentration, and number of times that you use the irrigant can be increased in order to help in the better disinfection process. So coming to EDTA, it's nothing but ethylene diamine tetraacetic acid. This was given by Niger Ostby in the year of 1957. So mostly preferred concentration is 17%. The one of the main advantage of EDTA is that it has got excellent dentin dissolving property. So it can be used in narrower canals, in calcified canals, because it will go and combine with the dentin, the calcium present in the dentin, and it's basically a chelating mechanism. So it will go and chelate to the calcium that is present in the calcified canals or calcified canals, and help in the easy removal of dentin. So as a result, it will get a better penetration of instrument deep into the canals, and it also makes the manipulation of instruments more easy. When it comes to tissue dissolving property, it is less when compared to hypochlorite. The disadvantage of EDTA is that since it actually is an acid, it will have an erosive effect on the dentin. So using EDTA as a last irrigant is not preferred basically. So the next is the chlorhexidine. Chlorhexidine has actually it's used in a 2% concentration. It has not got any tissue dissolving property or a smear layer removal property. It has got excellent antibacterial effect. The mechanism of action is basically electrostatic. The positively charged chlorhexidine molecules will go and combine with all negatively charged bacterial cell wall and causes lysis of the cell, and hence it also results in disruption of the cell. So it has got an excellent antibacterial property when compared to hypochlorite and EDTA, and it has got effective action against E. faecalis organism. This microorganism is found to be a major culprit in many of the endodontic failure cases, especially in retreatment cases. So this chlorhexidine is found to effectively eradicate this E. faecalis, and it has got a good substantivity nature. Substantivity is nothing but long-standing nature of chlorhexidine. So this chlorhexidine remain attached to the dentin or the tooth root canals for the longer time, like for like more than 72 hours. So this long-standing effect help in the excellent antibacterial activity. So as I've already told, it has got some drawbacks like no tissue dissolving ability or smear layer removal. So coming to interactions between these three irrigants, we have found to be there is an interaction when we use hypochlorite and EDTA. So we have to use it in a proper concentration. Otherwise, each of them can reduce or hamper the each other's activity. And similarly, especially when we use a chlorhexidine and hypochlorite, you have to be very cautious because it's preferred not to use continuously or together, because combination of these two will result in a formation of a precipitate, which is the orange colored precipitate, and it is found to block the tubules, and this will actually